Septic shock is a severe and potentially fatal stage of sepsis characterized by dangerously low blood pressure that doesn't respond to standard fluid treatments. It represents a critical escalation of sepsis, where the body's response to an infection causes widespread inflammation, blood clotting abnormalities, and multiple organ dysfunction. Immediate, aggressive medical intervention is essential for survival, as septic shock can quickly lead to organ failure and death. Overview stage: the most severe form of sepsis. Key features: persistent low blood pressure, organ dysfunction, high mortality risk. Triggers: infections, usually bacterial, though viral or fungal infections can also lead to septic shock. Mortality rate: high, with rates increasing significantly if treatment is delayed. Symptoms: septic shock symptoms build upon those seen in sepsis, with additional critical features. Severe low blood pressure: despite receiving intravenous fluids, blood pressure remains low, putting organs at risk of not receiving adequate blood flow. Increased heart rate tachycardia: the body compensates for low blood pressure by speeding up the heart rate, often above 90 beats per minute. Confusion and altered mental state: agitation, confusion, or drowsiness may occur as oxygen levels to the brain drop. Breathing difficulties: rapid, shallow breathing or labored breathing as the body tries to get more oxygen. Cold, clammy skin: reduced blood flow to the skin can make the skin feel cool and appear pale or mottled. Decreased urine output: reduced kidney function leads to minimal or absent urination. Organ dysfunction: signs may include liver, kidney, lung, or heart failure. Causes and risk factors: septic shock generally develops in response to an existing infection that the body cannot contain. Common causes include bacterial infections, infections of the lungs, pneumonia, abdomen e.g., appendicitis, peritonitis, urinary tract e.g., kidney infection or skin e.g., cellulitis. Viral infections, influenza, COVID-19, and other severe viral infections can occasionally trigger sepsis and progress to septic shock. Fungal infections, candida infections, especially in immunocompromised individuals. Risk factors include age: very young children and the elderly are at higher risk. Weakened immune system: conditions such as HIV/AIDS, cancer treatments, and autoimmune diseases increase susceptibility. Chronic conditions: diabetes, kidney disease, and liver disease. Invasive medical procedures, recent surgery, the presence of catheters or IV lines, or prolonged hospital stays can increase infection risk. Pathophysiology in septic shock: the body's immune response overreacts to an infection, leading to widespread inflammation and vascular damage. Vasodilation: blood vessels dilate, causing blood pressure to drop and reducing blood flow to organs. Increased permeability: blood vessels leak fluid into surrounding tissues, leading to swelling and further drop in blood pressure. Coagulation abnormalities: microclots form in the bloodstream, blocking small vessels and impairing blood flow, which can lead to tissue death. Organ dysfunction: reduced blood flow and oxygen levels harm organs, leading to multi-organ failure. Diagnosis: diagnosing septic shock requires blood pressure measurement. Persistently lower blood pressure hypotension despite fluid resuscitation is a defining feature. Lactate levels: elevated blood lactate indicates poor oxygenation of tissues, a common feature in septic shock. Blood tests, blood cultures, to identify the infection source. Organ function tests, indicators like kidney creatinine and liver bilirubin function to assess organ impact. SOFA sequential organ failure assessment or QSOFA score, used to evaluate and track the severity of organ dysfunction. Imaging, CT scans, ultrasounds, or X-rays may help identify the source of infection. Treatment: septic shock requires intensive treatment in an ICU setting to stabilize blood pressure, manage infection, and support organs. Intravenous IV fluids. High-volume fluid resuscitation is started immediately to increase blood volume and blood pressure. Vasopressors. If blood pressure remains low, drugs like norepinephrine are administered to constrict blood vessels and raise blood pressure. Antibiotics. Broad-spectrum antibiotics are given as soon as possible, usually within an hour of diagnosis, to quickly combat infection. Antibiotic selection may be adjusted based on lab results indicating the specific pathogen. Oxygen therapy. Oxygen support, or mechanical ventilation if necessary, helps manage respiratory difficulties and maintain adequate oxygen levels. Organ support. Renal replacement therapy, dialysis for kidney failure. Ventilator support, for respiratory failure. Other organ supportive measures, based on specific organ involvement. Monitoring and adjustments. Frequent monitoring of blood pressure, heart rate, respiratory rate, urine output, and lactate levels helps track response to treatment. Blood cultures and imaging are repeated if there's no improvement to reassess the infection source and adjust treatment. Complications. Septic shock can lead to severe complications, particularly if treatment is delayed. Multi-organ failure, damage to the lungs, kidneys, liver, and heart is common, with long-lasting impacts. Acute respiratory distress syndrome. Severe lung damage due to fluid accumulation can make breathing difficult and may require prolonged ventilator support. Chronic kidney disease. Kidney damage during septic shock can lead to permanent loss of kidney function. Disseminated intravascular coagulation. A clotting disorder where blood clots excessively throughout the body, leading to bleeding and organ failure. Post-intensive care syndrome. PICS. Long-term issues like cognitive impairment, PTSD, and physical disability can affect survivors. Prevention. Preventing septic shock primarily involves preventing infections and ensuring timely treatment of sepsis. Vaccinations. Staying up to date on vaccines like flu and pneumonia can prevent infections that might lead to sepsis. Early infection management. Prompt treatment of infections, particularly in high-risk individuals, can prevent progression to sepsis. Hygiene practices. Regular hand washing, proper wound care, and care with invasive medical devices reduce infection risks. Awareness. Educating patients and families on recognizing early signs of sepsis helps ensure they seek prompt care. Prognosis. Septic shock has a high mortality rate, with survival heavily dependent on early recognition and rapid intervention. The prognosis varies based on age, underlying health, the timeliness of treatment, and the extent of organ damage. While many patients recover, septic shock can result in long-term health issues, including chronic organ dysfunction, cognitive difficulties, and physical disabilities. Some survivors experience post-sepsis syndrome, characterized by ongoing fatigue, pain, and mental health challenges. Conclusion. Septic shock is a critical medical emergency that requires immediate and aggressive treatment. Understanding its symptoms, recognizing risk factors, and pursuing rapid intervention can improve survival chances and reduce the likelihood of long-term complications. Awareness of septic shock's signs and early treatment of infections are key to managing this life-threatening condition effectively.